Hello everyone. In today's video, I have 50 practice test questions and answers in this video to help you study for your mammo registry. I did a part one. I'll try to remember to link it at the end of the video and the playlist for the mammo registry review videos. Thank you all for giving part one a thumbs up. If you want part three, could you please give this video a thumbs up for me? In this video, I want to give in this section, I want to give a special shout out to these ladies who passed their registry by using or a part of it was using my playlist to help them study for. I don't know what other material they use outside of my videos, but I do know they came back to my videos and let me know that they did find them helpful and they felt like it helped them pass. So if you can, could you please come back to one of the videos that you have been using to study and just let me know when you pass or if you pass, and also you can leave a comment and let me know when you are taking your registry exam. So these ladies passed their registry in this month, or actually it was last month, July 2025, because today is August the 2nd now. So shout out to these ladies. And since I have my license through ARRT, I am following their content specification for their exam. So as you can see, for patient care, there will be 20 questions. Image production will have 30 questions. Procedures will have 65 questions. So procedures is your anatomy, positioning, image production is the physics. So anatomy is or procedures is the largest part of the test. It will give you a total of 115 questions that they will score you on. In addition, you have those 30 unscored poly questions. If you have not seen this before, this page, this is on the ARRT website. You can go to this link right here. And then down here, you can see 30 unscored pilot questions. And I always put this page in a lot of my practice test question videos, sometimes the registry review lessons that I make just so you all can remember how many is on the test, giving you a total of 115. All right, so I want to just read this disclaimer real quickly to you. If you can pause the video and read as well. So these practice test questions and answers are made to help you all pass your registry exam. Due to the registry's board's copyright law, these questions will not appear on your registry examination in this exact wording, but they are designed and constructed to test your knowledge in order to help you pass your registry exam. Since it takes time, effort, and research for me to make these questions for you all, I am going to read each question, answer choices, and the correct answer to avoid anyone from reusing my material and voice. If the audio bothers you, please mute the video. Being so, these questions are available to you for free. Could you please like, subscribe, and share the video? I would really appreciate it. Thank you all for watching and good luck on your registry examination. Please give the video a thumbs up or leave a comment if you would like part 3 to these questions and answers. This video will prepare you to pass your ARRT, ARRT CQR assessment every 10 years, or any National Mammography Registry boards. So I just wanted to throw that disclaimer out because I get questions all the time. Are these going to exactly be on the exam? I don't know. Well, everyone should know by taking their x-ray boards that you sign like this form saying that you will not share or give away the exact wording on the test or give away what's on the test. But that content specification, that's available for everyone to see. It tells you what's going to be covered. So anyway, I just wanted to throw that out there, as well as the reason why I just speak is because a lot of people aren't like physically watching the video. Sometimes people are listening to me as they are driving. Like I've gotten several comments where, and you probably can see it on the shout out board, but anyway, I've gotten several comments where someone has said, "Thank you, I listened to you while I was driving," several times, or someone may be washing dishes and they're listening to me as well. So Sometimes people can't always look at their phone. That's another reason why they like for people to talk. That's one reason why a lot of people don't have books anymore. But anyway, let me stop rambling. I'll get to the Q&A. All right, so please leave a comment to let me know how you did and how many questions you got right or wrong on this practice test. And good luck on your registry. Question 1. The second leading cause of death in the United States amongst women is A. Breast cancer, B. Cervical cancer, C. Ovarian cancer, or D. Thyroid cancer. Okay, I'll give you a few more seconds. All right, the correct answer is breast cancer. So that's why the doctors recommend annual screening mammograms to increase early detection for breast cancer, and it also helps reduce that mortality rate due to early detection. And I forgot to add, if I'm going too fast, you can always pause the video or rewind it. Question 2. Which organization does not recommend breast self-examinations and clinical breast examinations at any age? Is it the American College of Radiology, American Cancer Society, choice B, or choice C, American College of Obstetricians and Gynecologists, or D, U.S. Preventive Services Task Force? All right, the correct answer is U.S. Preventive Services Task Force. So this organization, they do not recommend self-breast examination or clinical breast self-examinations at any age due to an increase in stress in patients and increases in anxiety and stress in patients. So some point in your career, you're going to have a patient ask you, when should I stop getting mammograms? What age should we stop or I stop? And I always tell them the organization I go by or my job go by and let them know as long as you're in good health and expected to live 10 years and longer, they want you to keep coming in. But also talk to your doctor because I'm not sure which organization they are following because every doctor does not follow the same guidelines and I say that because maybe the last year or last time I went in for my pap smear, I had asked the nurse practitioner, I was like, hey, I've heard that there are some changes where now women can go or need to go every 3 years to get pap smears instead of yearly. And she said she did not like that guideline. And if you have had an increase or had abnormal pap smears before, you should not follow that. You should be going every year. And especially, she said, you can pay for it out of pocket. You do not have to follow that. So anyway, just wanted to throw that out that every doctor does not follow the same guidelines. Question 3. The X-ray tube that consists of a filament and focusing cup is called the anode, the cathode, the rotor, or the transformer. Right, just a few more seconds. Okay, the correct answer is the cathode. So from X-ray, if you remember anode and cathode from X-ray, the cathode is the negative side of the X-ray tube that consists of the filament or filament and focusing cup. Question 4. Which target material in mammography has a kVp range of 24 to 30 kV? Is it lead, molybdenum, rhodium, or tungsten? So is it A, lead, B, molybdenum, C, rhodium, or D, tungsten? All right, so the correct answer is B, molybdenum. So the target materials that are used in mammo is tungsten, rhodium, or molybdenum. But lead is not considered a target material in mammography. And the reason why molybdenum is the correct answer is because its ranges from 24 to 30. Question 5. The recommended source to image receptor distance or SID range that is used in mammography is A, 20 to 50 centimeters, B, 40 to 60 centimeters, C, 50 to 80 centimeters, or D, 80 to 100 centimeters. Okay, the correct answer is C, 50 to 80 centimeters. So the source to image distance or receptor distance SID refers to the distance from the X-ray source to the imaging plate. So just keep that in mind. SID does affect resolution, and a lower SID will increase magnification. So if you want to find your SID, because we all need to know where the SID is located, look above your imaging plate and the knobs at the top of the machine. So you see that I have the red arrow pointing to where you will find your SID. This is on the Hologic Mammo machine. So leave in a comment box if you have ever paid attention to this area on your Mammo machine, or if you only focus on the corner where you see the detectors being turned or the machine being turned at an angle. So which number have you focused on, or have you noticed that number at the top where the SID is at, where the arrow is pointing to? Let me know in the comment box. Question 6. Which monitors are used for the radiologist to read and interpret the mammogram images on? Is it the acquisition workstation, which is A, choice B, laptop, C, review workstation, or D, PACS monitors? All right, the correct answer is C, review workstation. The review workstation is the monitors that is used to interpret those mammogram images that the radiologist is reading from. So all diagnostic interpretation must be conducted on monitors certified by a medical physicist. So they cannot just go to Best Buy or Walmart and just pick out any computer monitor. This has to be certified through a medical physicist. Question 7. The breast meets the abdominal wall at which level? Is it A, second or third rib, B, fourth or fifth rib, C, fifth or sixth rib, or D, sixth or seventh rib? All right, the correct answer is D, sixth or seventh rib. The breast extends vertically from the clavicle bone. So just keep in mind, it extends from the clavicle bone at the level of the second or the third rib, and it meets the abdominal wall at the level of the sixth or seventh rib. All right, so if you are finding these videos helpful, please like, share, and subscribe for more videos. I do have probably 5 or 8 other practice test questions and answers videos. Um, they are labeled which one the questions for, whether it's physics, patient care, breast anatomy. But in this video, since it is a mock exam, you're going to have every category in this video that you will be tested on. So Just find those other videos for different questions and answers, and then these are new questions and answers. All right, question 8. The muscle in the breast that is thin, flat, and triangular is called A. Deltoid muscle, B. Latissimus dorsi muscle, C. Pectoralis major muscle, or D. Pectoralis minor muscle. All right, the correct answer is D. Pectoralis minor muscle. So the pectoralis minor muscle is going to be situated beneath the pectoralis major muscle in the chest. So the reason why we have to have at least the pectoralis major muscle on the mammogram image is because it shows the radiology and us that we have gotten as far back as possible and have covered enough breast tissue as possible. Question 9. The recommended dose for calculating patient radiation dose in mammography is A. Absorbed dose, B. Dose length product, C. Intra-skin dose, or D. Glandular dose. Okay, just a few more seconds I will give you. All right, the correct answer is D. Glandular dose. So the glandular dose is the choice of dose that we are using when we are calculating the radiation dose for mammo. Absorbed dose is used in diagnostic X-ray. If you remember that from X-ray physics, the intraskin exposure is the easiest way to measure and is the dose that the patient's skin is used for under diagnostic imaging. Dose length product that is found in CT. Question 10. The percentage of women that develops breast cancer with no first degree relative having it is A. 60%, B. 70%, C. 80%, or D. 90%. Right, the correct answer is 90%. So 90% of women who develop breast cancer, they do not have a first degree relative with that breast cancer disease, such as a mother, a sister, or a daughter. That is considered a first degree relative. Question 11. Which race has a greater chance of being diagnosed with breast cancer? A. African American women, B. Asian women, C. Caucasian or white women, D. Hispanic women. All right, the correct answer is C, Caucasian slash white women. So white women does have a slightly higher chance of being diagnosed with breast cancer in comparison to African American or Black women. Black women are more likely to die from breast cancer due to certain reasons, such as you have the environment, you have the lifestyle, staging, and treatment. Also, Black women may be fearful and they may not be as trusting. That's why their breast cancer is probably diagnosed at a later stage, which also make it harder to treat whatever type of breast cancer that they are diagnosed with. Um, in general, this probably applies to any race. When people think that something is wrong, but they don't go in because they're in their mind, they're thinking something is wrong, but I'm not going to go in. And I always tell people, I always encourage people, just go in, see what's wrong. because just because you do not go in doesn't mean the problem is not there. So that's why just with whoever, if you have family members, relatives, friends, just encourage them to just go into whatever appointment they have to because it's preventative and they're catching something if something is there. And if it's not there, at least they went in and they did their job. Question 12. The mammogram results should be sent to the patient within, is it A, 30 minutes, B, 1 day, C, 3 days, or D, 30 days? All right, the correct answer is D, 30 days. The results should be sent to the patient within 30 days of them having the mammo exam. Concerned findings should be communicated to the patient within 5 days from the date of when it was interpreted. Incomplete findings should be communicated as soon as possible as well. Um, Depending on where you work at, the patient may get their results in 1 day. They may get it the same day, depending on how fast the radiologist reads and how quickly the front desk people can send that information out. And a lot of times, if a patient has to sign a release form for prior mammogram, that can make it take a little bit longer to come in as well. That can take probably 10 days, probably 2 weeks. It just depends on where it's coming from. If someone is faxing the information back over in a timely manner, or if they are able to retrieve it. Sometimes if a patient is coming from like another country or another place where they just didn't remember where they had it at, then at my facility, that's okay. Then they'll just read the mammogram as is. Question 13. Which of the following have an effect on the resolution and sharpness of the image and is due to voluntary and involuntary causes? A, artifact, B, motion, C, noise, or D, pixel defect? Right, the correct answer is B, motion. So patient motion, it causes blurriness to appear on the image. This is whether it is due to voluntary motion or involuntary motion. Voluntary motion is best reduced through proper patient communication, and involuntary motion is controlled through good compression when the imaging is being taken of the breast. So, with the voluntary motion, make sure that you rehearse breathing instructions with the patient. Let them know that you will tell them to hold their breath because the last place they went to, they probably gave them different breathing instructions of what you are going to give them. And then also for involuntary motion, like let's say Parkinson disease, where patients, shake or move a lot, you can put, of course, take the best images as possible, but also put in the notes section, um, you know, patient unable to hold still due to Parkinson disease, limited study, or something like that. And I do have a separate video where I talk about how to chart, and just click on that video. It'll be found in my playlist to know how to chart properly in mammo and if you are in breast ultrasound or going to breast ultrasound. Question 14. The percentage of male patients that are diagnosed with breast cancer is A, 0%, B, 1%, C, 2%, or D, 3%. All right, the correct answer is 1%. Question 15. The enlargement of the male breast due to growth of the ducts and supporting tissues is called A. Invasive ductal carcinoma, B. Gynecomastia, C. Hamartoma, or D. Phylloid tumors. All right, the correct answer is B. Gynecomastia. In older men, gynecomastia can be triggered by certain drugs, disease, or the hormone estrogen that is used to treat cancer. Question 16. Mammography radiographs and the medical records of patients should be kept at a facility for A. 90 days, B. 1 year, C. 3 years, D. Not less than 5 years. All right, the correct answer is D. Not less than 5 years. So pretty much the mammo facility have to have those records for at least 5 years. So if the patient has no additional mammograms, the radiographs and medical records must be kept for not less than 10 years. So some states or local laws may require longer storage times. So just check with, if you want to, ask ask someone at your clinic at the front desk, ask your manager, how long do they keep the mammogram films or images for patients? Come back to the video and let me know what they say for your clinic. Question 17. The amount of radiation that a single mammogram projection can give patients are A, 0.05 MSV or 5 mRem, B, 0.1 MSV or 10 mRem, C, 1 MSV or 100 mRem, D, 2 MSV or 200 mRem. All right, the correct answer is C, 1 MSV or 100 mRem. So proper communication skills and clear instructions to your patients is very important because this is going to help you avoid repeating that mammogram image due to patient motion. So rehearse the breathing instructions with your patients before they start if needed, especially with patients who is in for their baseline, their first mammogram ever. Question 18. Which group of patients does breast density affect the most? A. Older males. B. Older women. C. Younger males. Or D. Younger women. Okay, the correct answer is D. Younger women. Keep in mind that the breast is made up of a mixture of fatty tissue and glandular or dense tissue. So as the woman ages, the breast slowly loses its glandular tissue. All right, so if you do not mind, could you please leave me a comment? Let me know what state you are watching from. I do have a lot of people watching from different states. I have Atlanta, Georgia, Houston, Kentucky, Connecticut, California, Maryland, Florida, Arizona. So I have a lot of people watching from all over. I have not gotten a comment yet about someone watching from another country, but if you have friends or family in another country or you know someone who is studying for their registries, send them these videos or my playlist because they can use this in their country as well. This is national and like across the board where it can help somebody pass their test. And I do have another slide where I'm glad that I have a lot of people commenting. So this person is watching from Memphis, Tennessee. So I want to fill up this page now so more people can comment. Let me know where you're watching from. I want to fill up this slide. All right. So also, could you please leave me a comment and let me know how well you did on the questions and answers? So did you get most of them right? Which area would you like more review questions on? Is it patient care, physics, or anatomy? Which area of the test do you think you would need the most help on? All right, now back to the questions. Question 19. This is a situational question for you. A female patient is scheduled for her routine mammogram. She is 45 years old and has a strong family history of breast cancer. Her genetic mutation test for breast cancer was negative. Her ordering physician suggests that she should start taking medication to reduce her chances of getting breast cancer in the future. Which medication or treatment did her doctor suggest? Is it A, chemotherapy, B, lumpectomy, C, tamoxifen, or D, radiation therapy? So I give you a few moments to think about the answer. All right, the correct answer is C, tamoxifen. So if you do not remember, tamoxifen is one of the anti-estrogen drugs called selective estrogen receptor modulators. I know it's a long word, but you may see it abbreviated as SERM, SERM. So the SERM drugs are used to block estrogen and can lower the risk for breast cancer recurrence in postmenopausal women. Question 20. Which drug is used to treat invasive breast cancer in postmenopausal women? A, chemotherapy, B, relaxafene, C, tamoxifen, or D, radiation therapy? All right, the correct answer is B, relaxafene. So raloxifene is another SERMs or selective estrogen receptor modulator drug, and the drug was originally um, wanted to be for osteoporosis. That's what it was being used for osteoporosis in postmenopausal women. But it was approved to treat women for invasive breast cancer in postmenopausal women. So the FDA did approve this. So if you are not familiar with your organizations such as FDA and the CDC, I do have a patient care video where I talk about this. I think it's for like an hour long. You can always pause it and pick back up where you left off at, as well as this video. If you have to leave out the video, write down what question you stopped on and then just come back to the video and continue, then rewind as many times as you need to. Question 21. How many fibers, spec groups, and masses does the New American College of Radiology Phantom has? Is it A, 4 fibers, 6 spec groups, and 2 masses? B, 5 fibers, 5 spec groups, and 5 masses? C, 6 fibers, 4 spec groups, and 5 masses? Or D, 6 fibers, 6 spec groups, and 6 masses? All right, the correct answer is D, six fibers, six spec groups, and six masses. And the purpose of QC that we do, the QC Phantom as well, is to ensure that there is consistent image quality and that the image will be artifact free. Question 22. The red arrow is pointing to, and I'll give you a hint. Well, I'll give you the answer in a second, then I'll tell you what the hint would have been. All right. So the answer is the fibers on the QC Phantom. So that's what I was going to tell you, but I was like, maybe they'll probably get the answer. So I want you all to think about the answer first. So it is pointing to the fibers. Question 23. Which of the following is considered the initial approval step required by all facilities in the United States before they can legally perform mammograms? Is it A, accreditation, B, certification, C, continuing education unit or your CEUs, or is it D, medical audit? All right, the correct answer is A, accreditation. Question 24. All of the following accreditation bodies should be contacted in order for a facility to be accredited for mammograms is SEB, A, American College of Radiology, B, State of Arkansas, C, State of Texas, or D, State of New York. So I'll give you a few moments to think about this one. Okay, the correct answer is D, State of New York. So this is something else that you need to know. If you do not know, let me know and I can make another video on these different states. But the American College of Radiology, the state of Arkansas, the state of Iowa, and the state of Texas is the facilities that must be contacted and with the accreditation body. So the state of New York is not one of those states. Question 25. How many hours of training are required for a mammography technologist, radiologist, and physicist to perform mammograms or read images on digital breast tomosynthesis units? A, 4, B, 8, C, 16, D, 24. Okay, before I give you the answer, I came up with something. Let me know in the comment box. Oh, I'll tell you in just a second because I want your comment on this and I don't want you to like skip over this part or miss this part. So the correct answer is B, 8. So I was gonna say, let me know in the comment box if the amount of questions is good for you all, because I don't know unless I receive comments, and I do make a lot of videos on my page with X-ray, CT, MRI, mammo. I will say my mammo people who are watching, I love how engaging you all are. Like, if I tell you all to comment, you all comment. If I tell you all to like the video, you all like the video. So that's another reason why I'm able to put out more mammo videos because you all request it, you all comment. So thank you all for that. So if you can, could you please leave me a comment and let me know how many questions in each video is good for you. Like, is 20 good? Is 30 good? Do you want 50 again? Like, just let me know so I can kind of try to make the videos around a certain number. Um, I can make longer videos. I can make shorter practice test questions and answer videos. So just let me know in the comment box, please. So question 26, how many continuing education units is required for the radiology technologists that will be performing mammograms? Is it A, 15 CEUs every 36 months, B, 24 CEUs every 24 months, C, 30 CEUs every 10 months, or D, 40 CEUs every 40 months? All right, the correct answer is 15 CEUs every 36 months. So, also, could you all leave me a comment below and let me know if you work in other modalities, or if you only work in X-ray and mammography, or if you only will be working in mammography only? I say this because if you do work in multiple modalities, it is better to just knock out those 15 CEUs first in mammo, and then your other 10 or 14 CEUs or 13 CEUs can be in the other modality, or you can do them all in mammo. But I probably would just do 15 in mammo, and then you can do the other ones, because if it's hard for you to find mammo CEUs, then you can just save that for a couple of years later or whatever. So yeah, leave me a comment and let me know if you all work in other modalities as well. Question 27, the red arrow is pointing to. The red arrow is pointing to the specs on a QC phantom image. Question 29. Which percentage of glandular and adipose tissue is the 4.2 centimeter thick compressed breast phantom is composed of? Is it A, 10% glandular, 90% adipose, B, 25% glandular, 75% adipose, C, 40% glandular, 60% adipose, or D, 50% glandular, 50% adipose? Okay, the correct answer is D, 50% glandular, 50% adipose. Question 30, the red arrow is pointing to. The correct answer is the masses of the QC phantom. Question 31. Which target tool in mammography is 26 to 32 kVp range used for? Is it lead, or A, lead, B, molybdenum, C, rhodium, or D, tungsten? Okay, the correct answer is C, rhodium. So keep in mind, lead is not a target material that is used in mammography, but molybdenum, rhodium, and tungsten is. Question 32. The compression in mammography is used to A, increase patient dose, B, increase patient motion, C, reduce breast thickness uniformly, or D, reduce the contrast resolution. Okay, the correct answer is C, reduce breast thickness uniformly. That's the main reason why we use compression and mammo, also to make the breast spread out evenly. So breast tissue compression, it does reduce patient dose and reduce patient motion. There are times where myself or someone else have taken or are taking mammo images on patients, and they say that the compression is hurting them, and sometimes it's like only 5 or 6 pounds on there, and then you have to keep retaking the image because we have not compressed enough to prevent the patient from moving. So that's another thing. If you have to keep retaking the image, let the patient know, well, it's showing motion. They probably won't know what motion is. So you can say it's showing some blurriness on the image. And that's because I'm not able to squeeze a lot on your breast or squeeze enough on your breast for that your breast does not move. You can say something like that. And maybe it'll help them hold still, hold their breath longer, or it'll probably make them let you squeeze a little bit more. Question 33. Which computer software program is used for handling, storing, printing, and transmitting information in the radiology department? Is it A, Digital Imaging and Communications in Medicine, also known as DICOM? B, Hospital Information System, also known as HIS? C, Picture Archiving and Communication System, also known as PACS? Or D, Radiology Information System, also known as RIS? All right, the correct answer is A, Digital Imaging and Communications in Medicine, also known as DICOM. Question 34. Which computer software program allows you to schedule patients, register patients, and see the billing for procedures in the radiology department? Is it A, Digital Imaging and Communications in Medicine, or DICOM? B, Hospital Information System, or HIS? C, Picture Archiving and Communication System, PACS? Or D, Radiology Information System, RIS? Right, the correct answer is D, Radiology Information System, or RIS. Question 35. The ability to image small objects that have a high subject contrast is called A, contrast resolution, B, matrix, C, pixel, or D, spatial resolution. Okay, the correct answer is D, spatial resolution. So make sure you all know contrast resolution and spatial resolution. Those two terms are confusing for most people, and I always, whenever I have these two terms together and like an answer choice, I always remind people, make sure that you know the difference between the two. Also, matrix and pixel can confuse people as well. Question 36. Which of the following is the major risk factor for male patients for breast cancer? Is it A, age, B, alcohol consumption, C, Klinefelter syndrome, or D, smoking? All right, the correct answer is A, age. The same as female patients, age is a major risk factor for breast cancer in male patients as well. Question 37. The size for most axillary or axillary lymph nodes are A, 1.5 centimeters, B, 3 centimeters, C, 4 centimeters, or D, 5 centimeters? Okay, the correct answer is A, 1.5 centimeters. You see the red arrow is pointing to the lymph nodes that is in the axillary or axillary region of the breast. This is a right MLO position. Question 38. What is the red arrow pointing to? All right, the answer is a skin fold. Make sure that the patient's arm is brought behind the mammo detector. You know, these wings, I know a lot of people call these like bat wings. Make sure it's like brought behind the detector. I'm trying to do it to where y'all can see it, and they hold on to that handle, because if this is like by their breast tissue, it's going to create a fold as well. Question 39. Which surgical option conserves the breast for the patient with breast cancer? A, lumpectomy, B, mastectomy, C, saline breast implants, or D, silicone breast implants? Right, the correct answer is A, lumpectomy. Question 40. A patient that has dense breast tissue will most likely have to alternate between A, breast MRI and mammograms, B, CT scans and mammograms, C, mammograms only, or D, nuclear medicine scans and mammograms. Okay, the correct answer is A, breast MRI and mammograms. So I do work in MRI. I have my certification through ARRT to work in MRI as well. And I perform a lot of breast MRI patients when I do work in MRI. And if you look under the time clock or right above me, you all know that image is a mammogram image of the right MLO. But if you look to the left of that image, that's a, excuse me, I've been talking for almost an hour, so I'm starting to lose my voice. But that is a sagittal, that's what we call sagittal whenever you get into CT and MRI. So that's a sagittal or side picture of the breast in MRI. And then if you look down to the bottom under choice answer D, that's also a breast MRI image. It's the image of both breasts. So when we're in MRI, we take images of both breasts. Even if a patient is coming in for a concern on their right side, we still have to image both breasts because of how the patient has to lay. You can't just take a picture of one breast. So that white area in the breast is the contrast that was given. And also it can be other breast tissues as well, but the white area that you see, let me highlight. So this at, well, I'll try to circle it. That's the heart that I just circled. And then you see white tissue in the breast, which is the contrast was given. All right, question 41. The random disturbances that obscures or reduces the mammogram image quality is called A, contrast resolution, B, noise, C, pixel, or D, spatial resolution. Okay, the correct answer is B, noise. Question 42. Which of the following involves the removal of muscle, fat, and skin from the upper back? Is it A, latissimus dorsi flap, B, lumpectomy, C, mastectomy, or D, transverse rectus abdominis muscle or your tram flap? Okay, the correct answer is A, latissimus dorsi flap. So that the latissimus dorsi flap is the removal of muscle, fat, and skin from the upper part of your back. The flap is it is tunneled under the skin whenever the patient is having the surgery. This is going to help create that breast mound, the pretty much form that new breast. Question 43. We're almost done. Thank you all. If you all made it this long in the video and you're still watching with me, if you're watching all the way through and you didn't have to get out the video, which it's okay if you did, leave a comment below and say, I watched all the way through. But for question 43, which portion of the breast contains 15 to 20 orifices? A, areola, B, nipple, C, pectoralis muscles, or D, skin? All right, the correct answer is B, nipple. Question 44. Which breast quadrant is the tail of Spence found in? A, lower inner quadrant, B, lower outer quadrant, C, upper inner quadrant, or D, upper outer quadrant? All right, the correct answer is D, upper outer quadrant. Question 45. Fatty breast tissue is primarily found in A, older men, B, older women, C, younger men, or D, younger women? All right, the correct answer is B, older women. Question 46. Glandular breast tissue is primarily found in A, older men, B, older women, C, younger men, or D, younger women? All right, the correct answer is D, younger women. Question 47. Milk production begins in the A, lobes, B, lymph node, C, skin, or D, terminal ductal lobular unit, or your TDLU? Okay, the correct answer is D, terminal ductal lobular unit. So also, if you do not see this long word, know that if you see TDLU, that's the correct answer as well. So if you see this long word, good, you know it. If not, TDLU also stands for terminal ductal lobular unit. Question 48. What does macromastia means? A, large breast, B, small breast, C, large pectoralis muscle, or D, small pectoralis muscle? All right, the correct answer is A, large breasts. Question 49. Which characteristics will a malignant lesion have? A, circumscribed, B, halo sign, C, spiculated, or D, radiolucent? The correct answer is C, spiculated. Question 50. Which characteristics will a benign lesion have? A, circumscribed, B, irregular, C, multiple lobulated, or D, spiculated? All right, the correct answer is A, circumscribed. All right, that's it for the video. Thank you all for sticking with me for this long. I just want to do just one long video for you all. If you liked it, let me know. I can make more. Please give the video a thumbs up. Hit the subscribe button so that you do not miss any new videos from me. Shout out to all of these ladies who passed their registry. They left me comments saying thank you. They passed. They found my videos helpful. The ladies on the right side of the screen, so it'll be my right, probably your right too. They passed, one passed in May of 2025, one passed in June of 2025. The ladies closer to the words on the left side of the screen passed in July of 2025. So shout out to you all. Like I said, thank you all for always commenting on the videos. Like I always ask you to, just engaging. Also, good luck on your registry. Leave a comment and let me know when you all are scheduled to take yours because I'll be on the lookout for a comment saying, hey, I passed my registry. But other than that, check out the playlist so that you can find all of my videos if you are new to the video. A lot of people that I keep seeing or that I think is watching, a lot of them have been watching for a long time. So I always kind of like just like say the same thing over and over because I do have a lot of new people that find these videos as well. So I want them to know where they can find the other videos if they don't know, because some people probably have been watching since the beginning. Some people probably caught my videos in the middle. Some people probably this is their first time seeing this video. So anyway, thanks again for watching, and I hope to see you all in the next video. Just let me know if you want a part 3. And bye.